I don't think you're prepared for death. I don't think that we're told to examine how we feel about death. We're so involved in how to take care of the patient, how to turn the monitor on, how to defibrillate someone, how to get an IV started, how to work as a team. But it's very difficult to remove yourself for just 5 or 10 seconds from what you're doing trying to save someone and actually look a patient in the eye and say, we are with you, somebody is with you.
Learning to be present with that family.
You have to care about them.
So clinical means that we go beside the bed, be with a person, show up, and we're aware of who they are as a whole person.
It's very, very personal.
And I think that common denominator is we're all human.
Right.
It needs to be more personal. I had really, really good parents. I'm lucky, very, very, very lucky, very blessed. They were good people. My dad was a very stern man. His dad was a drunk. My dad's biggest desire in life was not to be like his dad. My mom was a very loving, giving person. She loved my kids, both of my kids, loved them both. In about 1985 is what I remember. My dad I was riding with him coming home from Athens, and one day we went over there to do some work, and he told me that he'd been coughing up blood, and he showed me. And then Mama started to getting sick, and she kept telling me she felt bad. She kept telling me that she was going through menopause, but she was having hot flashes, and she'd get sweaty and all of this, and it turned out that she had cancer in her colon. And Dad had it in his colon, had it in his liver, and it got worse after that. It got really bad fast. Mom got to where she couldn't take care of herself, and there was times that Dad would be in Nashville in the hospital, and Mom was in the hospital here, and it wasn't fun at all. A lot of running, a lot of stress, a lot of me and my wife got a divorce. And I was going through all of that at the same time, and I had 2 kids and felt like that I needed to spend time with them, couldn't. It was very stressful. I was stretched about as far as I could go, and I felt like I needed to take care of my mom and dad, and I did. I did the very best that I could with the knowledge that I had at the time, and it was basically I was learning as I went.
I think education is one of the biggest aspects of social work. When you go into a home, a lot of people are not prepared for end of life because, media doesn't talk about end of life care. It's going to happen to every one of us, but we really don't hear a lot about it. But just knowing what to expect in those final stages, and the social workers make sure that we have that education component, not just with the patient and their immediate family member, but everybody that's coming into the home, because you have lots of outside family members, outside pastors, all sorts of people that are coming in and out of the house. And so it's making sure everybody has been educated and prepared for the end of life.
My dad was he got really bad. My mom was in the hospital over here. I took him to the VA hospital. He was in the VA hospital. I fully expected him to come home alone. Okay, I knew my dad was going to die. He hadn't said a word in 3 days. He wasn't even awake. We had to carry him in the hospital when I got there. And there was this doctor came along, he's a professor, teaching, he had a bunch of kids with him, college students, and they wanted to look at my dad. because he had been diagnosed with what was called carcinoid syndrome. Carcinoid being a type of cancer. The syndrome, actually the cancer wasn't bad enough to kill him, but the cancer created a toxin in your body that shut down your electrolytes. So that's what it was doing. It was just shutting him down. He was just slowly dying, and they couldn't get him back. And he told me, he said, I went outside while they were in the room, and he came back out and he said, you know what your dad's got? And I said, yep. And I had a little 2-paragraph clipping out of a medical magazine. I handed it to him and he read it and he said, that's it. That's exactly it. And I said, yeah, but there ain't nobody knows nothing about it. Nobody can help him because nobody here knows anything. And he said, you found the right man. And I said, you're kidding me. And he said, nope. He said, we're doing a study on this right now. And he said, I would like to take your dad over to Vanderbilt. And most people don't know that the VA hospital in Vanderbilt's connected by several underground tunnels. And I literally had to run to keep up with them. They moved him over there so fast. And he said, I want to run a few tests on him. And he said, then I'm going to give your dad something. And he said, you're not going to believe it. And he said, you're just not going to believe it. He said, I can't even explain it to you, but you're not going to believe it when you see it happen. I said, okay. I said, you're the only one I know of that knows anything about it. He said, if you want to learn more about this, the Vanderbilt Hospital has a library. So you have to be either a patient there or next of kin of patient, and you can go to the library. Otherwise, you can't go. So I go to the library every day, and I read about this and learn as much as I can about it. So that's where I got a lot of my knowledge from it. The rest of it was from Dr. Anthony. Dr. Anthony was a really good man to explain things to you. Very down to earth. He wasn't above you. He didn't think he was better than you. Nothing. He was just a good human being.
One of the greatest challenges that all healthcare providers in modern society have to deal with is the reality how to integrate professionalism with individual touch when providing quality care to the patients. And caring is not something we say, it's something we do. When you do something caring to people, people can feel it emotionally. So that kind of emotional engagement not only requires a great deal of understanding of humanity, but also understand culture.
Most people in Appalachia are easygoing. Generally find a tougher breed of people, a group of people who have endured a lot of hardship in life. They've, I guess you would call it, they've come up, you hear it all the time, they've come up by their bootstraps, and that's a pretty good explanation of the people.
There's deep wisdom in that culture. And there's a level of caring that's oftentimes absent in traditional Western medicine, because a lot of traditional Western medicine is intentional insulation between the provider and the patient. We intentionally give a pill that numbs things. We intentionally order a test that distances us from the psychological component. We intentionally put something between us and them so that we don't have to get down in there and care. Whereas the whole point of Appalachian health care is being present with the person. And you can't apply a poultice without getting some under your fingers and smushing it down onto the wound. I mean, you have to be present with that other human being to put a poultice of yellow root on their cut. You have to care about them. There's huge wisdom in that.
But a lot of the people here tend to care for each other, I think, a little bit more than you see anywhere else. Even though the bad does exist, there is still people here who care for one another. You see people, if there's a hardship somewhere, people will come and help. Simple things. People need firewood for heat. People will just get together, and I've done it 100 times. Just go out with a bunch of people, cut firewood, take it to somebody's house and dump it out and say, there you are. You know, and I think that's the way most of the people around here are, you know, in Appalachia. And I find that too in my travels, going from one end to the other. And I've talked to a lot of people. Love to talk to people. I love to talk to people when I get there and get a feel of how they work and everything. Everything is simpler here. And to me, when you get away from this environment, things get a little more complicated, and everybody expects you to do certain things. Everything is more mechanical, more electronic, more everything, you know. It's just complicated. It gets too complicated. And I think that's what sets Appalachian people apart. They're not complicated.
I think for me as a clinical chaplain resident, I think one of the first phrases that I heard Owen say, or one of the other supervisors, is when you come into this clinical setting, you are your textbook. There's a lot of reflection that happens while we are interacting with the patients and the staff and the families, and a lot of that reflection goes back to our own family systems and our worldviews, how we were raised, social demographics, education, and what we bring into that room with that family. So learning to be mindful of that and thoughtful and holding those worldviews, or how we filter certain situations, that's part of our training here as well. Learning to be present with that family and allow them to have their story while we hold our own, and just be there with them.
Just recently, we went to hospital, and my daughter had a little surgery, minor surgery done on her knee. And I thought the doctor was extremely focused on what he was doing and telling us what he was going to do when he came in to speak to us and tell us the procedure and go over all the information and tell us how it was going to happen. And he was very nice about it, and when he got done, he stopped and paused and asked us if we had any questions, and gave us a chance to ask questions, and he answered those questions. Then he asked if it was all right if he prayed for us and prayed for this surgery, because it was his belief, and he gave us, told us that, you know, it was okay if we didn't believe what he believed, but this was his belief, and I'm good with that. I think that was great. I think that was a very nice and a very good idea, because to me it showed, even in his concern, although I believe what he believes, but he still showed great concern and used the things that were available to him to help in this situation, and he believed that this would help in his situation. And basically it helped to put us at ease and made us feel more comfortable with him and being around him, and I appreciate that. It was very nice.
Caring is a fundamental element of human society, and humans need emotional engagements, and all humans are various groups, and has the traditions of emotional engagement, socializations, and caring for each other.
At this point in time, you've got to realize the difficulty in all of this, because my dad was in the hospital in Nashville at Vanderbilt. My mom was in the hospital in Athens. Both of them really bad sick, okay? Now, this was all long distance stuff, and it was hard to keep up with. We needed somebody to help us, to let us know what was going on, so that we would understand without having to be there with them. And for the most part, they were. The only disappointment that we really had that I can think about was the one in Knoxville. But at this point in time, we had found people who are willing to help. The doctor in Athens was willing to help. Dr. Anthony in Nashville at Vanderbilt was willing to help. He eventually wanted to see my mama. At this time, it was still a mystery as to what was going on. And then we found out that Mom and Dad both worked at Oak Ridge, and Dr. Anthony told us no need looking any further. So he is now looking at my mama after she got out of the hospital in Athens. I took her to Vanderbilt. He looks at her and he determines that basically mom and dad both has carcinoid syndrome. And this is something that he specializes in, he and Dr. Oates. To tell you the truth, we never checked into Vanderbilt Hospital but 2 times, the first time and the last time. The first time, after the first time, when my dad, his electrolytes would get really low and we would have to go to the hospital, they'd put him on an IV, get him back up, increase his dosage of medicine, and at the same point in time, it wasn't working for my mom. My mom progressively got worse. Daddy progressively got better. The difference is my mom wasn't diagnosed as fast as my dad. So we just didn't get her in time. That's all it boils down to. But Dr. Anthony helped my mom. He gave her a couple of years, good years. He gave my dad 15 good years. And just because he knew we found the correct person, not only was he a good doctor, he was a good man. A really good man. And I can't tell you how good he was. And he took care of my dad.
Sometimes it's best for the patient that you do nothing, that you sit there with that patient and just hold their hand. You don't have to know everything as a medical provider. You may have to say to that patient, I am so sorry that this is happening to you, and I don't know what to say, but I can be here with you.
My mom died in 1990, and my dad lived on to 2000. At one point in time, near the end of my dad's life, at this time we know he had a stroke. At the time he had it, I didn't know what was wrong. So we took him to Nashville. This was the second time that I had to admit him into the hospital and go through admittance. And it was the last time. We stayed over there for a month. I was at Vanderbilt for a whole month. In the end, Dr. Oates told me that my dad would not be able to go back home. He told me that I would not be able to take care of him by myself, and he told me that I would probably have to put him in a nursing home and that they could put him in Murfreesboro. And I told him that I had promised my dad that I would not put him in a nursing home and walk off and leave him. And that did not happen. And it was not going to happen. And I told him that if they could get him in one at home in Etowah, where we live, and that would be fine. That my dad would recognize that he was at home and not at some strange place. So they worked on it, and they were extremely nice. This social worker that did this made this happen, and she went above and beyond her duty. Very nice lady, and got him in a nursing home in Etowah, which worked out. My dad lived exactly 30 days after he come home.
Social workers are very good at tying things together. So if you're a nurse or a doctor or a physical therapist and you're going into a home and you're faced with some of these challenges that I've been talking about, such as the family is unreceptive to what you're saying to them because they simply don't agree, because they haven't had that information, and when you're trying to educate them, it's just not working. The social worker is really good to pull in to try to get everybody on the same page and help educate the family, help prepare the family. We're kind of the glue in the whole scenario, and so we can make sure that it's a smooth transition and that that the person is able to pass away in the most comfortable and dignified way, with all of these professionals being able to do what they need to do for that to happen, and for the family to be as prepared and comfortable with the situation as they are.
And it worked out. It really worked out. Now I I was happy. The only thing that I regret is, and there's no way you can know this, but if I'd have known my daddy was only going to live 30 days, I'd have took him home. Because he wanted to die at home. He wanted to die in his house. And that was important to him. Wasn't, you know, honestly, it wasn't important to me, but now that I look back at it, it was important to him. I have 2 nurses that are customers, and they both tell me the same thing. You need to pay attention to the person that you're working with and what their needs are, and learn what their needs are, and not just pass over it like, oh well, they're going to die anyway. I thought my dad was, oh well, going to die one time too, and he lived 10 years longer just because somebody came along that knew what to do. And like I said, when we ran across Dr. Anthony, I mean, he was the man. He was our savior. I mean, Daddy wouldn't have made it in very long without him. And he was very good to Daddy. He told me one time, he was, like I said, he was a very straightforward guy. He told me, he said, I like that old man. He said, I really do. I like him.
There's one thing about suffering, and especially in a clinical setting, suffering is a lot worse when you're alone. And in a clinical setting like a hospital, on the staff, really no one has time to spend with the patient, to be with the patient, and to spend that extra 5-10 minutes listening and understanding and caring about them. So I guess that word care really comes to the fore in our area. Not to say that the nurses and doctors and all don't care. They're busy. They're busy.
Everyone knows that nurses are compassionate, doctors are compassionate, social workers are compassionate. We have people that go into a field that services people, humans, are there because they see the need and they have it in them to do it. We have to know the technological aspect of it and the all of the medical terminologies, all of the medicines. We have to know that to save people. But I think that we also have to know how we can help them in a way that maybe someone else can't.
You know, what comes to my mind is I'm always struck and so impressed with the skills that nurses and doctors and all those people have. If you watch them work in the trauma bay, I mean, how do they learn and know how to do that and hold somebody's life in their hands? And the stresses that nurses have, and going from room to room, dealing with personalities, but they're responsible for that person's health and life. And if you're not careful, you can get so focused on the clinical part of it, the one meaning of the word clinical, that you lose the holistic human person side of it.
As time went along and I would watch nurses, I would see different nurses who actually, when they came in, when they talked, they knew what was wrong with my dad. And then there was nurses who came in who just didn't care. They were just there to make a dollar. And in this kind of environment, in this kind of job, you need to give a little bit more than just to be there for a dollar, you know, because somebody's life depends on it. My daddy's life depended on it.
Sometimes it seems like nurses don't have compassion, and I think that maybe that some nurses use that as a way to protect their own feelings, because they don't know how to approach someone that's dying. They don't know what to say. They feel very awkward or they feel uncomfortable. And so they use a very business-like professional approach that they're going to get their treatment done or their dressing change done and give care to the patient that way. And they don't feel comfortable giving themselves.
People all the people who work in the hospital, you've got to understand that people's lives in their mind are coming to an end, and they need to know what's taking place. You can't just say, we'll take care of it. I don't want to hear you say, I will take care of it. I want to hear you say, here's how we're going to take care of it. This is what we're going to try. If prayer is part of that, great. I'm good. Let me know that. People who do not know me, I do not know. I know nothing about medicine. I know a lot more now than I did, but I know nothing about it. We expect you to know everything. Although you don't, I know that. But we still look to you because you are the professional, and that's why we're here.
Well, in internal medicine, we've kind of adopted a tagline. It's, you may not always be able to cure, but you can always care. And in caring, you cure. You bring healing. It may not be physical healing, but you bring healing to the person. And so I think I would want them to know that in the transition of healthcare and the pressures of just doing your job, we can tend to forget that what we have before us is a person who has feelings, who is scared and hurting, and we just need to treat them as a human and care for them.
You have to think about what your feelings are about death. Have you ever experienced being with a family member that's died? Have you ever held the hand of somebody that's dying? Have you ever just sat there with somebody, not say anything, just so that they know that they're not alone while they died? That is an experience that you'll never lose.
But I would think that it needs to be more personal. People need to be, just like we talked about earlier, about people in this area taking care of each other, you know. It needs to be more personal.
Yes, there is a time to be professional and to give orders and to do all of the things that we need to do with the patient. But we can't forget that part that drove us to become a nurse or a physician or any kind of healthcare provider. What drove us was the need to help other people, to be that compassionate person in their time of need. And in return, we're given something back even more. Thank you.